today we are bringing to you one of the videos in our series intended for technician training. So today's video will be about heartworm prevention, selecting the best heartworm prevention, the importance of heartworm prevention, and it will be taught by Dr. Chris Duke. And so I'll introduce him right now, and then we will get started. Dr. Chris Duke is the co-owner of Bienville Animal Medical Center in Ocean Springs, Mississippi. He's a member of the American Heartworm Society and the American Society of Veterinary Journalists and contributes regularly to several publications. Dr. Duke has served on the AHS board since 2016 and is currently the immediate past president. Welcome, Dr. Duke.
Well, thank you, Jenny. Hopefully we'll impart some information and have a little fun, and you'll pick up a little trivia along the way today. So that was my goal. But yes, as Jenny said, I'm a general practitioner on the Mississippi Gulf Coast. And so you can ask me over my 39 years of practice, has heartworm disease been prominent? And yes, it has. And I think one recurring theme you'll hear me talk about this morning is the importance of starting both dogs and cats on preventive medication early on. The education starts in those exam rooms. And here's a map I keep in every one of my exam rooms. It's our heartworm incidence map. This one is from 2019, and the American Heartworm Society composes a new incidence map every 3 years. As a matter of fact, we're compiling the 2022 data now. You know, we do it early in the following year because it gives us a chance to let contributing clinics and shelters bring their data to us so we can make new calculation maps off of it. As expected, you see hot spots in the country. My Gulf Coast here, the Mississippi River Delta, the South Atlantic states. Those have traditionally been problem areas that we've encountered with heartworm disease. But notice how the map seems to spread. And every 3 years when we update this map, it seems to encroach into new areas of the country, even out west where it's dry and mosquitoes are more minimal than they are in the east and possibly in some of the other places where there's a lot of standing water and mosquito populations. Why is it ever expanding? I think there's several theories out there. We know that people don't sit still. We people travel for jobs and relocate, and we bring our pets with us from different areas of the country. We know that mosquito migration varies, and when you have an active vector like a mosquito, if mosquito populations expand, then the potential for infection expands as well. And, you know, I don't know about where you are, but here on the Mississippi Gulf Coast, as I'm recording this, we're in March, but it's been spring-like since the middle of February. And so, yes, mosquitoes and other gnats and bugs have been quite active already down here. And so we have ever-expanding seasons, especially when we have warm years like this. Of course, the result, here's what we don't want to see. And this is from an autopsy of a dog that had heartworm disease. And you can see both male and females represented. Just the damage that this causes. You know, the fact that, as you just saw on the map, we can't get complacent about this. We've seen cases documented in all 50 states. And so wherever you are, you have to prevent dogs, and for that matter, cats, because we do see cases in cats. They're not, the worm counts aren't as numerous as you see here, but it only takes 1 or 2 worms in a cat's heart to create damage. Pulmonary damage that we get from not only the worms themselves being here, but they can embed themselves in lung tissue as well, and we catch that on autopsy. But this is what we're trying to avoid. It takes months to get there with this many adult worms, as we'll go through the life cycle shortly, but this is the enemy. The damage that it causes in some of these dogs. Here's a small dog where we've obviously had congestion to the point of ascites, where not only the caudal vena cava, but the portal vessels and those that are behind the chest, that, you know, it perfuses and leaks into the abdomen because of the damage. I get asked sometimes on cases like this, do you actually drain the abdomens? We do to help them feel better and to feel comfortable so that maybe they'll get a little more active and eat better. But as I always talk to my colleagues about, when you get these bad cases of ascites, the best thing to do is say, hey, ultimately, we've got to kill some worms because you've got to undam what's blocking the process. They'll breathe better. They'll have a better circulation throughout their body once you get the obstructions out of there. This is one of our infographics that the American Heartworm Society put out. And it's very simple, but it speaks volumes. We can't tell by looking at a dog from the outside if they have heartworm disease or not. Sure, in that previous slide with the ascites, we might, but what we have to do is, once again, start these dogs and cats on prevention product early on in the process, on those puppy and kitten visits, and keep it up. Because the only way we know in dogs is to year recheck them with a blood check and make sure that they're still antigen negative. You'll hear one of my colleagues on the diagnostic part of our technician education going into detail of the cat diagnostics. That's tricky business. It's a little messy, but the fact is, we have to do it from the prevention standpoint because, well, we don't have a certified treatment method in cats. All we can do is symptomatically treat them. And in dogs, as we'll talk about shortly here, once we get into that antigen test positive status, the only thing we can talk about at that point is treatment, because it's too late to do prevention alone and expect that we can get rid of the worms. So we'll go back to the heartworm life cycle. And I always like to start right in the middle there where the dog has the mosquito accompanying it, because the mosquito is where it all starts. Whether you're a dog or a cat, that mosquito bite is where you get that infective larva, the L3, that gets into their bodies. As I always say, when mosquitoes bite animals, they don't just make a withdrawal, they take a deposit, or make a deposit, they take a withdrawal. They do it the other way around. They infect them with the L3 larva, but they also pull in an L1. And just remember that the L1 to L2 and L2 to L3 evolve on the mosquito. So once that L3 is in a dog or a cat's body, that's where that prevention blocks it. It cannot evolve into an L4 or an adult L5 and hurt that pet if that prevention catches it at L3 and doesn't let it go into L4. So I know there's a lot going on in this chart, but what I've done is a, hey, let's keep it simple slide. L1 is the baby heartworm in the dog's bloodstream. Cats, L1s or microfilaria don't really survive very well. They die out from their immune systems taking them on. L2 develops within the mosquito after the blood meal, and then L3, the infective larvae, goes out the mouth parts of the feeding heartworm. The feeding mosquito, I should say. L4 develops in the tissues for the next 2 months, and if prevention doesn't stop the process, well, that's when we get heartworm positive dogs on these tests. There is talk about a reach back on our prevention products, 45 to 60 days. You can't always hang your hat on that. And that's why if dogs miss a couple of doses, we, as the American Heartworm Society, suggest a retest to make sure that you're okay before you resume treatment. Because what happens is once it gets past the point, you can't get prevention to do the job for you. It takes about 4 to 5 months of growth, where it's kind of the dark period of testing before an antigen test will light up positive when heartworms are in the heart. And only malarcamine will treat these. It's too late for prevention to take on these worms. Breedings of the males and females create the L1s, the microfilaria, and thus the cycle continues. We have to break the cycle 2 ways. I won't get into treatment. I know that's another module, but the treatment entails not only staying on a prevention product to keep it from getting worse, but also doing the adulticide treatment to take those on with malarcamine. That's the only way to do it. You have to work on both levels. This is a close-up of the male and female heartworms. You see the little screw tail and the thinner male in the background there. The more strong, sophisticated female heartworm is there in the foreground. And you can see in her thickened body, that's why they're tougher to kill than the males, the reproductive system. That's her uterus traversing the long plane of that body. It's been told to me by my parasitologist friends that as much as 70% of a female heartworm's body is the uterus. And so that's understandable that they're a powerhouse when it comes to breeding. And so when we do these heartworm treatments, once again, the males are the first to fall, but the females are a little more stubborn to kill. This is a heartworm antigen test, and those of you in veterinary clinics have probably seen the red line test or the blue dot test, as we call them. This is an IDEX test that we commonly use in my veterinary hospital. And this is a positive test because you see the second dot lighting up very strongly as opposed to the positive control. I always say in our veterinary hospital, we'll be gliding along and having nice preventive visits and puppy visits and mature cat and dog visits, and all of a sudden stop the presses. We've got a heartworm antigen positive. We have to have a new talk. And it's very important that we have that talk, because not only does this client need a great amount of communication, but they need some product to leave with. Obviously, they need to leave with doxycycline and a heartworm prevention if they've not been on one. I know that sounds counterintuitive, but you have to keep them on a heartworm prevention product, even if they're heartworm positive, to help with population control moving forward. We also download the American Heartworm Society outline that shows them. We walk them through what we do at day 60 and day 90 and day 120 and so forth, because it is kind of a dicey thing to do it all verbally and say, we'll tell you when to come back. It's nice to put it on paper, and by the end of the visit, put that paper in their hand and say, we'll be getting back with you to come back for this visit and that visit and so forth. And so we use those as communication tools very commonly in my practice on the Gulf Coast. So let's talk about the vector a little bit, the mosquito. I love this one. She's tough. They, as we've seen, all 50 states represented, they can infect these dogs wherever, whenever. They can live indoors and outdoors. They adapt. This is something. A female mosquito can ingest 3 times her weight in blood. Since they're in charge of reproduction, that's what they're getting the blood meals for, to help support growing new babies, starting another generation, depositing those microfilaria. Here we go again. Or should I say, developing those microfilaria in her little nursery there. Males, yeah, they're busy pollinating and doing other things with vegetation, but the females, they're the ones who are aggressive about the blood meals. And she's sneaky. Yes, the mosquito season is impossible to predict. Once again, this spring here on the Gulf Coast, we're well into it. You have to just protect your pets year round, because you don't know how long that fall is going to extend, or how early that spring is going to start. Here on the Gulf Coast where I live, we had around December, a little before Christmas, we had a couple of cold freeze nights, but since then it's been very mild for the most part, and we have just kind of coasted right into springtime, like I said. Let's talk about the heartworm prevention chemicals. We have the ivermectin group, the milbemycin group, and the moxidectins group. And collectively, they're microcyclic lactones. They come from soil microorganisms, the genus Streptomyces. I bring this out because I think a lot of times when clients are talked to about putting pets on prevention, they think it's something cooked up in a lab synthetically or something of that nature that could be harmful to their pet. And I always bring it home that the ivermectins, milbemycins, and moxidectins come from the soil. They're basic building blocks of things to protect them, and thank goodness we did find them in the ways we did. A little trivia for you, the ivermectins were discovered in the late 1970s in Japan when they were clearing land for golf courses. And I understand some of the milbemycins are farmed out of kind of like muddy areas in the Caribbean to put into some of these products we're about to talk about. So yeah, they're not just cooked up in a lab. The basic building blocks from them come from nature and soil. I'll start with the first one that came out, HeartGuard, back in the mid-1980s. It's been on my shelves all these years, and it's an ivermectin-based product, as is IverHeart Plus and TriHeart Plus that you see here. We also have the milbemycin products, like, for example, the Sentinel products there, the Trifexis and the Milbegard. These are all good products, and they've been circulating through veterinary hospitals all over the country for a while. I might add that we have combination products represented here too. For example, the Trifexis covers not only your heartworm protection, but your intestinal worm protection and fleas. You also have, for example, the Simparica Trio that I haven't touched yet on, that also contains Ceralander, that does not only flea, but tick protection, along with your heartworm and flea protection. These are not the complete list. These are just products that are carried and put on the market by our sponsors that we represent with the American Heartworm Society. But they do show you that you've got some great basic products to start with for heartworm and worm control. HeartGuard for cats, even there in the right corner. I don't want to be remiss and forget that one. But here's the deal. the HeartGuard for cats, an ivermectin product, we don't sell a lot of because most people with cats don't want to fight with pills. And so I'll get into topical alternatives in just a moment. But I think it's important that your takeaway here is you've got a good array of products that do some good work in these pets, protecting heartworms, intestinal worms, and in many cases, they're combination products that take care of fleas and ticks as well. So I told you about topical products. We'll go there. That's very important, especially with cats. And you see cat figurines on most of these packagings here. Revolution, for example, in the lower left corner, Advantage Multi. Advantage Multi is for dogs and cats. That's a moxidectin product. And Revolution, of course, is an ivermectin product. You've got the selamectin that's also in the ivermectin family that's used there for the Pyridine. The Centriguard is a good product for general overall parasite control. Selamectin is also represented in Synergy there, as is Pyridine as well. Bravecto Plus, I love their packaging because they have the furalaner that extends into tick control with the moxidectin for the heartworm and worm control. And you can just read the varmints that it controls on the front of the package there. So it educates the client right up front that Bravecto for kitty cats is an effective product. I know with my cat, I put on the product once a month at the first of the month between the shoulder blades. And I truly enjoy not getting into having to peel my cat. I'll just tell you that. And finally, the ProHeart products that are the injectables for dogs. This has really changed the game, especially if a client has compliance problems. I had a client tell me not too long ago that they had a dog that caught heartworms because they just plain couldn't keep up with pills. And this was the answer, because they can go to their veterinarian either every 6 months or every year and get the ProHeart shot. The ProHeart shot is available in the ProHeart 6. Easy to remember. The dog has to be at least 6 months of age to get the ProHeart injection for that one. Or ProHeart 12. We use a lot of ProHeart 12 in our practice. ProHeart 12 can be given after a dog is a year of age, and it can be repeated every 12 months. And yes, it's compatible with annual vaccines. So if a dog is in for its annual checkup, you can give vaccines and a ProHeart injection concurrently. We've done it many times safely, and that's important to know. One more area, especially in endemic areas like we live down here, is to use a repellency product to help with heartworms. We have enough products that say, okay, let's give those monthly, or in the case of the injections, ProHeart 6 and 12 injections. But obviously you have to use a prevention product for fleas and ticks. Why not add repellency to it as well? Vector 3D, extremely powerful product against fleas, ticks, flying insects like flies and mites and so forth that get on their skin even. Frontline Plus, traditionally a very good shield product here for dogs. It's got the flea and tick prevention in it and does a very good job on repellency of mosquitoes as well as the Vector 3D did. And the Canine Advantage too, I love that one because once again, it puts all the varmints on the packaging and says, yeah, we're good against lice and mites and flies, and mosquito repellency is all good. But important point, if clients use a repellency product, don't let them discard their heartworm prevention product. Sometimes clients say, when I ask them in for an annual visit and we'll catch up on their diet and their weight, we actually have an exam sticker that we have to get filled out on every annual visit to make sure that we check all the boxes. The weight and the diet, what is the heartworm, what is the flea control, are you given one? And occasionally they'll think that, oh yeah, I'm giving Canine Advantage too, for example. Isn't that taking care of the heartworms? No, it's not. Stop. Let's be sure you're getting a heartworm prevention product while you use a flea, tick / repellency product like this. But it's important, especially in endemic areas, to use these as well. So what's the best heartworm prevention product for my pet? I get asked that sometimes, not only by clients, but sometimes I get online questions. And the answer is two things. And I'll give you a third as a bonus, but the first thing is, number one, what kind of lifestyle does the pet have? Are they indoors or outdoors? Are they a couch potato that never goes outside even to go to the bathroom because they can go to the potty on their own? Obviously, they're not going to have a big risk, but I would at least recommend that they get on a monthly heartworm prevention product. Secondly, besides that, And by the way, that is counter to maybe a hunting dog that goes out and is exposed to everything, including the ticks and stuff that we talked about. So you might want to get a combination product for that. So yes, lifestyle is important. Second, compliance potential by the client. Compliance is so important. If you have a heartworm product that a client has been remiss in giving before, or maybe they've gotten a dog that's caught heartworms before and they say, well, I've done that before, the heartworm prevention, but my dog caught heartworms because I forgot and got off schedule. Well, maybe going to an injectable would be a solution in that case. So yes, the capability of the client staying compliant is so important. And a third thing is there are some products that link themselves a little more strongly to epilepsy. So I guess co-medical conditions like that should be considered if you've had a reaction from a product before, or that's pre-existing before you go into a prevention program with a pet. So in saying all that, I'm going to hand it over to my colleague Paola and let her take it from here.
Thank you very much, Chris. Okay, now Paola Dominguez is going to take over from here. She is a certified veterinary technician who works in Gainesville, Florida at the University of Florida. She works in the Veterinary Community Outreach Program, and she is a fellow board member on the American Heartworm Society. And she is going to tell us a little bit about how she would communicate each of these points to a client.
Thank you, Dr. Duke, and thank you, Dr. Riso. Hi, everyone. Today, I will talk about heartworm prevention education to clients from a veterinary technician's role. Our case today is about Lila. She is a 12-week-old Labrador. Lila's owner is an experienced dog owner, but it has been years since she has owned a puppy. The client knows Lila must be on heartworm prevention, but cannot remember when the correct age is. The veterinary technician explains to the client that a puppy can be started on heartworm prevention as soon as the prevention label states it. Since Lila is 12 weeks old, she can start heartworm prevention today. For education purposes, the veterinary technician explains to the client that a puppy should be started on heartworm prevention, ideally no later than 8 weeks of age. The technician goes over the different kinds of heartworm preventions available, for example, like oral prevention, topical prevention, and injectable prevention. The technician also goes over the different brands available at the clinic and their prices. It is important for technicians to go over different brands and prices with the clients. Knowing what the client can afford and what fits their lifestyle is extremely important. This can help the client remain compliant with the prevention. So go ahead and sit down and give them the options. Throughout the years, I have learned that a client does much better with things being written down so that they can analyze them properly. It is also important to keep in mind to give them the space to go over things either by themselves, talk it over with whoever is in the room with them, or with the other pet parent that might not be physically there with them, so they can go ahead and give them a phone call and talk it over with them. So what's next? Because Lila is a growing puppy, the veterinary staff explains to the client they will dispense one dose at a time. Lila should come back the following month to check her weight or when her next booster vaccines are due and get her next appropriate heartworm prevention dose then. When the dog stabilizes in a weight range, then more doses can be dispensed out at once, either a 6-month or a 12-month package, or other forms of prevention can be discussed further. It is at this stage that it is extremely important for technicians to form a positive technician-client-patient relationship. Remember that a well-informed owner is one who will be compliant and feel comfortable asking questions when they do arise. Here is the link to the American Heartworm Society Resource Center. Please use it for yourselves, staff education and client education. There are videos for veterinary staff as well for clients, like fact sheets, infographics, and so much more. Please go ahead and scan this QR code now for a free membership to the American Heartworm Society while you are enrolled in a veterinary nursing program. Thank you so much for attending this webinar on heartworm prevention, and keep on learning.